Good morning, I'm Adam Sexton. We hope you're having a good Memorial Day weekend as the nation honors those who made the ultimate sacrifice in defense of American liberty and turns an eye to what are hopefully some much healthier months ahead. Here this morning to discuss the pandemic outlook for New Hampshire is the state epidemiologist, Dr. Benjamin Chan. Doctor, thanks for joining us.
Good morning. My pleasure to be here.
So earlier this year, the governor pinpointed this spot on the calendar, Memorial Day weekend, as a potential turning point in the pandemic. And here we are. As you've noted, we're in this transitional time with community spread ongoing and the vaccine also bringing numbers down. Could we see daily cases and total hospitalizations hit single digits this summer? Or is it more realistic to expect us to kind of bump around where we are for a while?
Yeah, so that's the hope, that we're going to get community transmission as low as possible. What the exact level is that we end up leveling off at, I think still remains to be seen. But, you know, the last several weeks we've seen the numbers of COVID in our community substantially decrease. We expect the numbers to go even lower. And the goal over the next several weeks is to try and get the levels of community transmission of COVID-19 as low as possible, which will allow people to resume more normal activities over the summer. I think we're going to begin to be able to recommend that people can go into public locations without the strict face mask use and physical distancing, especially for people who are vaccinated, you know, as we transition to lower numbers over the summer. But we're still, as you mentioned, in that transitionary period. The numbers are trending down, but we still have a moderate to substantial level of COVID-19 in our communities around the state. And so there's still need to, you know, and we continue to recommend that as many people get vaccinated as possible and continue to recommend precautions during this transitionary period.
Normally, coronaviruses are seasonal, so what should people be ready for or expect in the fall?
Yeah, so again, the goal is to get the numbers of COVID-19 in our community as low as possible over the summer. I think, and we expect that likely numbers will be low, but what happens come the fall time, I think still remains to be seen. Keep in mind that there's still a substantial proportion of people in New Hampshire that are not yet able or not yet authorized to get a COVID-19 vaccine. Anybody 11 years of age and younger is not eligible yet for the vaccine. What we're hearing from our federal partners is that that may not occur until, you know, fall and winter. And so come the fall time, there's still going to be a substantial level, a substantial number of our, you know, residents who are not yet fully vaccinated. That's going to likely put us at higher risk come the fall and winter for numbers to begin to go back up like we saw in this past year. But the goal is to have vaccination be increasingly the way that we control spread of COVID-19 and blunt any increase or any new surge we might see come the fall or winter.
When will we know if COVID-19 is going from a pandemic illness to an endemic illness? Or is that ship already sailed? Are we going to see this, you know, for years and years ahead?
Yeah, so a pandemic refers to a global, worldwide outbreak of, in this case, an infectious disease. We are still globally in the midst of a pandemic. What I think we're seeing here in New Hampshire and across the United States are the beginnings of a transition out of the pandemic phase. And I think what we're going to see over the coming weeks and months is trying to transition to something that's more normal. Right? COVID-19 is not going away. And most people, I think, at this point believe that COVID-19 will be with us. It will routinely circulate in our communities, whether it becomes seasonal, you know, like we see with some other viruses like influenza, enteroviruses, other coronaviruses, where they tend to increase in the fall and the winter months. That's certainly possible. But we do expect COVID-19 to be with us for months and likely even years. And so we need to find a way to control and manage this virus as we do with other typically circulating viruses.
Outside of those definitions of pandemic versus endemic, there is that sort of reality setting in that some people are acting as if things are great and life is back to normal, and others are continuing on with all the precautions, the distancing, the masking, even being vaccinated at the same time. It's a range. So do you think it's on you and other medical professionals, particularly epidemiologists, to say what's right or wrong on that spectrum, or is it better for you to stay out of that?
So, Interesting question. So first off, I think it's on all of us to work to control the pandemic and control this virus and protect people in our communities. I think it's our job as public health professionals, epidemiologists, scientists, to put out the best available information in science and to put out our recommendations. And I think we have tried to do that over the course of this pandemic. You've seen us assess the science, review even things like the federal guidance and federal recommendations, and sometimes chart our own path or put out our own recommendations that we believe are in the interest of residents and communities in New Hampshire. And so that's something that we'll continue to do. So I think our core job is to put out the best available science, make recommendations, and to rely on our public community partners to help us control spread of this virus and protect people in our communities.
How many undiagnosed asymptomatic cases of COVID-19 do you think have been out there in New Hampshire? Is it potentially a very significant number?
Yeah, that's a great question. It's hard to pinpoint the exact number of asymptomatic undiagnosed infections. We track a number of different data points, not just the number of diagnosed infections. Part of the reason we look at test positivity rates is because that can be a marker of how well we're doing as a state to diagnose infections. So when the test positivity number is low, that's an indication that we're doing a good job of testing and identifying, COVID-19 in our communities. When the test positivity is high, it means we're likely missing a lot of infections. And so, we've seen the test positivity trend downwards over the last weeks and months, similar to the number of diagnosed infections. But there will always be infections in our communities that are not being diagnosed. And that's something that we have to learn to manage and control and to continue to have people practice, the typically recommended measures to protect oneself against not only COVID-19, but other respiratory viruses, good hand hygiene, covering coughs and sneezes, not going out in public places when people have, respiratory symptoms and are feeling sick. Those remain important public health messages for not only controlling COVID-19, but other respiratory viruses as well.
As you're thinking about, not just how the public approaches this, but how you approach this, the communication aspect and the public communication aspect have been huge over the last year. When eventually that, weekly briefing goes away, how do you plan to connect with the public? And we know we've kind of missed you with health headlines here on our monthly, noon show with that. But do you worry that if you're not hammering on this on a weekly basis on a public platform such as WMUR, that more people will kind of fade out of taking those precautions?
Yeah, so that's definitely a risk, right? And the goal is to balance our communications with the risk that we see in the community. And so I think it's normal and expected that as risk decreases, likely there will be less public messaging. But just to be clear, that COVID-19 is with us over the summer. COVID-19 will be with us into the fall and winter. We may, as I mentioned, even see increases in COVID-19, especially as people start to move indoors and the weather gets colder, and we're still, working at vaccinating, people in New Hampshire. And so there will be a need for ongoing communication about this over the coming months. But as more and more people get vaccinated, as levels of COVID-19 decrease and spread comes under control, then the communication aspect of this will also appropriately de-escalate, and there will be less and less communication. But this is always a challenge with any infectious disease is coming up with the appropriate recommendations and messages, not only for the public, the general public, but also our public health and healthcare partners in the community. But we'll continue to work at that.
I'm curious for your thoughts on the next pandemic. And we know that depends a lot on the contagion, and so there's huge unknowns with that. But we know kind of what the state does well after a year. What do you worry about for the next time this happens? Some weak spots potentially that this is identified.
Yeah, so it's a great question. New Hampshire, as well as our federal partners, are going to be doing a deep dive, what we call after-action reviews of how this pandemic has progressed and how the response has progressed. One of the key and important features of any outbreak, or certainly a pandemic, is that public health can't control this alone, right? We need our local partners there, certainly our healthcare providers, but also others in the community. I think the pandemic has shown us that the need to, very actively and proactively engage, business partners and other non-healthcare community partners. But even at a national and a global level, it really has shined a light on areas we need to improve around certainly national coordination, being able to better respond to these types of situations nationally and certainly globally. Hopefully the next pandemic is going to be a long time in coming, but if history is any indicator, there will be new and emerging infectious disease threats that are coming to us on a regular basis. The question is whether they develop into a much larger pandemic, but that's the whole reason that public health is here, to monitor these situations, put out accurate, hopefully reliable information, and appropriately inform our partners and the public on what's happening with new and emerging infectious diseases.
And last question for you here, Doctor. You've been under the spotlight and under pressure for the last year, and I've got to say, you've been one of the most cool, calm, and collected public officials, not just at the state and local level, but at the national level as well. So I've got to ask you, was there ever a moment where you just went home out in the backyard and just started yelling or shaking your fist at the sky? How did you manage all this stress?
Yeah, it's a great question. We've been at this now for over 15 months, and that's, by any measure, an incredibly long response. And what I will say is that what has supported us through this are our partners, both community partners, but certainly our team here at the state and in public health. I have the privilege of working with a great group of public health professionals who have been incredibly supportive. And then certainly I have to give a call out to my family, and certainly my wife, who has been right there throughout the pandemic, supporting me, supporting our team in public health. These are the kind of responses, as they drag on, become more and more tiring, and you can't do it alone. You need the people around you to support the work, and this translates into public health as, we need our partners on the ground and in our communities supporting the work of public health to be able to manage and control something like a pandemic.
All right, Dr. Chan, always on message. Thank you for joining us for Close Up.
Thank you, Mike.